Well, it's been nearly 2 years since the COVID-19 pandemic was declared, and nearly 2 months since the Omicron variant emerged, affecting hospitals and prompting a reassessment of public health measures. So, should it change our collective approach to the pandemic? For more on this, we're joined now by Dr. Brian Conway, an infectious diseases specialist and medical director for the Vancouver Infectious Diseases Centre, and in Hamilton, Dr. Martha Fulford, an infectious diseases specialist and associate professor at McMaster University in Ontario. Welcome to you both.
Thank you.
Pleasure to be here.
So, Dr. Conway, I will start with you. I'm wondering what your assessment of the current strategies in place to fight COVID are and how that strategy might need to shift.
Well, I think we need to accelerate the pace with respect to vaccination. That's our first tool. We also need to make sure that the public health measures that are in place in various cities, provinces are appropriate to the current stage of the pandemic so that we limit community-based spread. I think that vaccination with appropriate public health measures together will get us somewhere where at some point this pandemic will evolve into an endemic. So I think this has served us well and will continue to serve us well going forward.
And Dr. Fulford, what is your assessment of current strategies that are in place and how they might need to be reassessed?
I probably have a rather more optimistic take on this. What we're seeing from Omicron right now is an extremely mild illness for the vast majority of people. And this has been clear in South Africa, in the UK, in Denmark, in the United States, and quite frankly, in Canada. If we look at who's being admitted to hospitals, the people who normally get admitted to hospital during respiratory tract seasons, which are very frail, vulnerable seniors, really pretty much without exception. And any younger person, the numbers, if you compare them to hospital admissions last 10 years, they're very similar. And so I do actually think that we're in a very different situation with a very different virus, and we actually do need to pivot. And I think we should be shifting much more to a more balanced approach in terms of focusing in on the people who most benefit from the vaccines and the boosters, making sure that we have strategies in place to protect our vulnerable, but also acknowledging that a lot of the mitigation measures we've had, while maybe necessary in the first year and a half, are not benign. We have caused profound harm to our children. We've destroyed businesses. We've shattered dreams. People need to have a balance in their lives. It's not COVID versus no COVID in my mind. It's a control of COVID, and we've done a remarkably good job of that. We have a vast amount of population immunity already with the vaccines. And quite frankly, we have to acknowledge, as the literature is clearly showing and as being seen in other countries, that people who get COVID and recover get a very good immune response. And so that's not to say that everybody should just go and get COVID, but when they've had it and recovered, we need to consider that. And so if we combine our vaccination rates with recovery rates with a very mild illness, I think that the people need to say now, why would we have something shut down as opposed to just have everything shut down? So I'm no longer in favor of this sort of sledgehammer approach. I think we need to start to back off. We can learn from the United Kingdom, we can learn from Spain, we can learn from most of the United States. And that would be my take. So it's a slightly different perspective. Fair enough.
And, Dr. Conway, I do want your reaction to that. I mean, there's no question here that certainly there has been a very deep impact on children staying away from schools, on the mental health of the general public, on businesses, on the economy, etc. That is definitely something that would be not disputed by anyone. So is the approach that Dr. Fulford is suggesting here, a more balanced approach that perhaps we're seeing in Australia and the UK and Spain, is that something that Canada is ready for and should be taking?
Well, I respectfully submit that we do have a more balanced approach than we did last year. If we take the schools, I think we have recognized that having children, teenagers stay home is devastating to their physical health, to their mental health, to the health of families, the health of societies. And we have done everything we can, generally quite successfully, to keep our schools open. We've had a more nuanced approach to certain businesses. We've understood the risks of high-level lockdowns, and we've tried to keep some of the businesses open or reopen those that we closed, perhaps in error, well-meaning at the time, but we've allowed them to reopen. And gyms is a good example here in British Columbia as a source of comfort, a source of zen, a source of recovery. But let us remind ourselves that Omicron is not benign. With the numbers of people that are infected, there is a proportion that get very severe disease, and we're seeing for the first time severe disease and an increase in deaths in the young and healthy. It for sure affects frail populations more as all respiratory viruses of certain severity do. But if a child or a young adult gets long COVID, then this is going to go on for decades, and that's what we're seeing a little bit with Omicron. Or if we allow the infection to spread too easily in the community, more frail individuals in whom vaccine-induced immunity is waning could get infected and have serious outcomes as a result of Omicron. Having high viral transmission in the community will encourage the development of variants that may once again be more dangerous and delay recovery from the pandemic itself. And I think to rely on immunity from natural infection, we've learned from the other variants that's unpredictable and it wanes. And our current recommendations is whether you've been infected or not, that you get the same vaccination regimen so that we are not relying on immunity from natural infection as a tool to get us through the pandemic. So we need to be more nuanced. Absolutely. High level, complete lockdowns are really going to hurt us more than they're going to help us. But I think a nuanced approach, and I come back to vaccinations, there's a group of individuals who have refused to be vaccinated. And if we sort of start talking about this as nearly the end, then I think our leverage to convince them to do what many of us think is the right thing is go out and get vaccinated, that will be lost. And this is a group of people that may sustain community-based transmission far too long.
You know, Dr. Conway, I do want to point out, the top medical officer in BC, Dr. Bonnie Henry, did say everyone is going to be exposed to Omicron. She said that back in December during a press conference. So is that not then the path to herd immunity? Is that not the way to make this endemic and then live with COVID? That would be, perhaps the argument that some would deduce from her comments.
Well, I think a couple of things I would say is I'm not sure she ever said that would then lead to immunity that wouldn't require vaccination. And I think to rely on Omicron-induced immunity to protect us in general against COVID, especially when we live in a world where half or more of the general population of this planet are not vaccinated, and we may import another variant at some point, we would want to have everyone doubly or not, if not triply vaccinated before that eventuality occurs, and then get ready for our next shot along with the flu shot in the fall. And I think taking all of that together is what's going to help us get through. For sure, we need to have businesses, schools, and all other institutions that can stay open with the level of knowledge that we have now. Please have them stay open. And in fact, as recently as last night in British Columbia, we've shortened the quarantine period for infected individuals to 5 days as long as they are well at the end of those 5 days. And this minimizes the impact of infection on the types of services, healthcare services, schools, daycare centers, than it might have. So we're getting smarter, applying the knowledge, but there is a risk of going too fast. And I think we have to have those kinds of discussions and not say Omicron for all, let's be done with it, and that's the end.
Dr. Fulford, I do want you to respond to that and also perhaps, address the question of some are suggesting here that why were we not focusing, it's been almost 2 years now, why were we not focusing on the recruitment of healthcare workers and expanding space within hospitals and capacity within hospitals rather than lockdowns, which much of the country has seen?
And that actually is going to be probably one of something that there's going to be a lot of discussion about, which is why we didn't follow standard pandemic management plans, because we had well-developed pandemic management plans which don't involve lockdowns. The normal strategy is to protect the vulnerable. You zero in on high areas of transmission. You try to do control in those areas, but it's very targeted. You create surge capacity, and you don't destroy the fabric of your society. And so, for example, school closures, lockdowns, what we've done is unprecedented. It's not part of any standard pandemic management plan. All we had to do is take our plans, remove the word influenza, put in the word COVID, and we had plans. But I mean, and this is, and the issue is what kind of nuance people will accept. I'm obviously of the position that I actually do believe that natural immunity is robust. I've seen many trials are coming out. We have more and more. We've got preprints. We've got data now from the group that's just published in New England. From Qatar, we've got stuff from South Africa. We've got lots of information on breakthrough infections in the UK data, and even our own data in Canada. And it's not that it's perfect, but honestly, the vaccines are superb. They have done everything we wanted to do in terms of prevention of severe disease, hospitalization, and death. But we have to be pragmatic about our expectations. It's never going to be zero. And for any infection. And so for me, the balance is, yes, I'm actually of the school of thought that with the speed that Omicron's spreading, we are all going to get infected. And I am much more in favor of the concept of the hybrid immunity and allowing people to begin to resume normal lives and make their own individual risk assessment. I don't think the government needs to tell every single person anymore. We're an intelligent country. We can figure out how much risk to have on our own.
And, with the final 60 seconds here, I just want to ask each of you this, and Dr. Fulford, I'll start with you. In terms of when this does become endemic, what is your timeline looking like?
Well, the interesting thing is, if you look at severity of disease that Omicron's causing, it's actually the same as the respiratory viruses we deal with in hospitals all the time. So if you look at just pure severity of disease and absolute numbers of people hospitalized, we're there. But there's a psychological, societal acceptance in terms of ability to coexist with something and accept that actually we've got other things we want to focus in on, and we're willing to live with this now. So it's a combination of that, but also a psychological shift.
And the same question for you, Dr. Conway, in terms of a timeline.
Well, we got caught last year when last summer we sort of said this is all going to be over by Labor Day, if not by Thanksgiving Day. So let me say this. Let's have a good summer. Let's have as open a summer as we can with as few cases as we can, and then let's talk.
All right. Thank you so much to both of you for your time.